Saya Amrita Rutalim.
And my name is Nadia Balkis binti Muhammad Johari.
Do you guys know what is stroke?
Stroke is a life-threatening medical condition that occurs when there's an insufficient blood flow in the parts of the brain.
There are two types of stroke, which is the ischemic stroke and hemorrhagic stroke. The ischemic stroke is when a blood vessel supplying blood to the brain is obstructed, and it accounts for 87% of all stroke. While hemorrhagic stroke is caused by the rupture of a weakened blood vessel, which then bleeds into the surrounding brain.
Next, signs. Remember this acronym, FAST. F for face weakness. Can the person smile? Has their mouth or eye drop? A for arm weakness. Can the person raise both arms fully and keep them there? S for speech problems. Can the person speak clearly and understand what you say? Or is their speech clear? And T for time. Call 999 if you see any one of these signs.
Let's look at the symptoms. There are 6 symptoms which includes paralysis, difficulty finding words or speaking in clear sentence, sudden blurred vision, amnesia, sudden dizziness, severe headache. So this is our client case.
Let's move on to evaluation. Oh, before that, let's take a look first at OT process. There are 3 OT process overall, which is evaluation, intervention, and outcome.
So in this part, we'll discuss about evaluation. So for cognitive, there's a assessment called Mini Mental State Examination, MMSE, which is a set of 11 questions that are used by doctors and other health professionals to check for cognitive impairment. Cognitive impairment is when you have problems with your mental ability and you might have trouble with remembering things. And also, you might have trouble learning new things or concentrating, and sometimes it can affect on how you make decisions that affect your daily life. The MMSE is a test. You will be asked to do a set of tasks such as trying to remember a few objects and then repeating the list back later, copying a drawing, writing a short sentence with correct grammar. An example could be the dog sat on the floor, correctly saying the current day of the week, and you may also be asked to say the date, month, season and year, correctly saying where you are, and usually the test takes about 5 to 10 minutes, and the test is usually the same or similar for everyone.
So, this is the MMSE example form. Next, for the ADL, we use Modified Button Index (MBI) for the assessment. Modified Button Index (MBI) is an ordinal scale that measures a person's ability to complete activity of daily living (ADL). Published in 1965, the original index was created to measure disability in patients whose rehabilitation impairment affect the use of their limbs to complete activities of daily living. The higher the score, the more independent the patient is in completing the measured ADLs. Any member of the multidisciplinary team can perform the Button Index, but it is typically complete by clinical staff such as nurses, occupational therapists, or physiotherapy over a 24 to 48-hour period.
The Battle Index assesses 10 common ADLs, including basic mobility, feeding, bladder, bathing, toilet use, and so on. Typically, the assessment takes only minutes to complete and can be a part of a rehabilitation evaluation.
Here is the example of MBI assessment form.
Okay, so next, for the short-term goal, for the cognitive intervention, it is to improve their memory skills.
Our short-term goal for ADL intervention is to strengthen the language.
Now let's take a look at the first intervention. Memory strengthening training. The method that we use are repetition and space retrieval. Modalities is use memory aids like a memory notebook or smartphone reminders that enforce daily routine and appointments.
The second intervention for difficulty to put on or off dress, we use method 100 dressing training. The modalities, we use dressing stick or button hook while putting a dress. and the last intervention for ADL in difficulty on showering, we use 8 device for bathing as a method and use long-handled bendable sponges and brushes to allow patient with all body parts as a modalities.
After all the assessment and intervention that we had done for Adriana, here are the outcomes. So, patients are satisfied after the treatment. Patient cognitive skills had been improved after the following treatment plan, and the patient had achieved the short-term goal plan successfully. Patient can be independent after going through the treatment plan, and lastly, the patient does not need any further treatment.
That's all from us.